Tracking COVID-19 and finding a vaccine, it all comes down to testing. Governor Inslee has said his goal is to see Washington performing 20 to 30,000 tests per day statewide in order to lift most of the physical social distancing measures. Right now, the state is seeing around 6,000 tests per day.
The government has said repeatedly, anybody that wants to get tested should be tested, but the fact on the ground is that's not what's happening.
Paul Song is trying to help. He's CEO of a joint partnership between Anissa Spine and Pain Care and Atlas Genomics, now offering the first drive-up testing site for anyone, regardless if you're showing symptoms. Schedule a $99 appointment online at one of 4 sites like this in Renton and get a COVID-19 test without leaving your car.
We've only been open 2 weeks and we've already tested hundreds of people.
The tests are fully certified. His company was already set up to test and handle other diseases. Pivoting the business was relatively easy. We wanted to try it ourselves.
How are you doing?
The test involves swabbing the inside of my nose. They told me to make it uncomfortable, but not painful.
Okay, make sure it doesn't touch anything though.
Okay.
Many of them are just companies who come to us and said, hey, can you come and test, all of our employees?
That includes senior living homes like Bellwood Assisted Living in Issaquah. Bellwood had an elderly resident test positive for the virus, and residents have been quarantined for weeks.
You're going to switch it around 4 times?
Atlas Genomics is being paid to test all staff members and residents, even if they're not showing symptoms.
We've had to reduce our engagement with them, engaging with life. By testing, it gives us an opportunity to create a little bit more activity and engagement.
The FDA has a list of several approved testing methods, including these nose swabs, finger pricks, blood samples, and more, all in an effort to try and flatten the curve.
We were just looking at what could we do to be a part of the solution.
And Mimi, I contacted the Department of Health, and they say testing, of course, is good, but they insist there is little value to testing asymptomatic people because you can be sick for 5 or 6 days before showing symptoms, and in that time there is a probability of a false negative. DOH says it needs more capacity to test at-risk people. But Mimi, it was results in less than 24 hours. Accuracy, they say, is really high, and I am negative.
Well, that's good news. I guess I'm just wondering, just watching your reaction as you were swabbing your nose. Was it painful? Was it uncomfortable?
No,
it's all
it's
worth
not
it,
painful,
but I'm
like
just
I
curious.
said. Yeah, I mean, small price to pay for knowing whether you are infected or not for sure. So not trying to discourage anybody. They tell it, make it uncomfortable but not painful. And it is not as deep as we've seen other tests. There is, some medical professionals that believe you don't need to go back as far into the nasal cavity to test. So that's being sorted out. But yeah, uncomfortable to say the least, but worth it.
All right. Thank you, Jake.